Now let's talk a little bit about the treatment for genital pain disorders. So again, this is for vaginismus as well as vulvodynia and the other types of pain disorders. So if you look at a scale from 1 to 10 and you have two parallel lines, you will have a physical scale and emotional scale from 1 to 10. On a physical scale, a 1 might be hugging, and then you move up the line, hugging, touching, kissing, removing of shirts, touching breasts, removing pants, removing underwear, touching genital area, perhaps some oral stimulation, but also perhaps not. You have touching externally on the genitalia, and then you have internal touching, and then a 10 that would be moving progressively up and then moving up toward vaginal intercourse. On a scale from 1 to 10, on an emotional scale, you are generating her feelings of comfort and relaxation and safety and arousal. So she is becoming more and more increasingly comfortable and uh, confident and relaxed with her partner. So the goal is that as we are increasing the homeworks from a 1 to a 2 to a 3 on the physical scale, she's also learning how to feel emotionally appropriate at each scale, step by step, because we don't want her to be having manual stimulation which might be an 8, if she's only feeling a 3 with her partner emotionally, as far as feeling comfortable and not judged and safe and relaxed. So we want those numbers to match. So if she is doing an 8 physically, we want her to feel at least an 8 emotionally. Now, along with moving on that technique slowly by slowly, at each step, we're going to help her feel three pillars, my 3 pillars, which are relaxed, in control, and aroused. When she has accomplished a good amount of a high level of in control, feeling relaxed, and feeling aroused at level 2, then she can move on with confidence and with positivity and with the skills that she'll need to be relaxed, in control, and aroused at level 3. So, this is similar to other types of anxieties or aversions or phobias. Just as somebody who is phobic or aversive or terribly anxious with flying, you wouldn't just pack them up, put them on an airplane, and send them off on a flight to China. You have to ease them into it slowly in a controlled manner and teach them the skills they need to be relaxed and to feel confident with each step of the way. So you would you would show the person a picture of an airplane. And when they have accomplished the skills necessary to be successful at that, then you can move on to looking at a video of an airplane, and you would move on progressively, until they could work up to taking a short flight in that matter. So it's the same way with these type of anxieties and with pain. Now, so not only is it important with a pain disorder that a woman would feel relaxed, because then her vaginal muscles and her pelvic floor muscles would feel relaxed, but she also feels then in control, and she feels confident and positive. Now, she also needs to feel she absolutely needs to feel in control, because if she does not, she's not going to welcome penetration. And lastly, the importance of why we need arousal is because there's an actual physiological benefit to arousal. And according to the chart that you'll see in the PowerPoint, the graphic that you'll see in the PowerPoint, you can see how a woman being aroused allows her vaginal canal to widen and lengthen. You also have more lubrication. You also have increased blood flow, which make the vaginal tissues much more supple, flexible, more comfortable. So it really makes that is actually in and of itself a pain um, reduction or elimination technique is merely arousal. And now when we combine it with the relaxation and we feeling confident and we're in control, that's when you can really see the effects. Now, um, we're going to talk about vaginal dilators. At the same time that we're easing a woman into sexual activity again, she needs to be practicing with physical therapy and with dilators at home. So she's going to be progressively inserting dilators week by week, hopefully nearly every day, in order to gain confidence and gain the skills that she needs. And, as she works up the skills of increasing the dilator sizes, she's going to feel confident, and then she's going to feel positive, and that she has reached goals, small goals, each step of the way. And by the time she reaches the largest dilator, perhaps even larger than the size of her partner, even, or the same as the size of her partner, then she's going to feel that, well, if I can do the dilator, I can have intercourse with my partner. There's no physical reason why I cannot. At that point, she has that aha moment that she really can do this. All she needs to do is get in the right mindset at that point. So we'll get her there. There's tons of gynecological interventions as well. So you really want to work together with a good gynecologist. We're looking for assessing vascular abnormalities. We're certainly assessing for vestibulitis or vulvodynia. There's hormone creams that can significantly help many women. Estrogen creams such as estrase or Premarin. There's also estrogen and testosterone composites that can be formulated that can really help women, with vaginal atrophy. So that's going to also help with the pain. Like we talked about before, earlier in the differential diagnosis. So we definitely want to get a differential diagnosis. We really need to know, what is she dealing with? Is this only vaginismus, or is this vaginismus, pelvic floor dysfunction, in addition to another condition like vulvodynia? We want to treat infections for pain that could be caused by yeast or strep. We perhaps that diazepam suppository could help, a lidocaine numbing cream, vaginal moisturizers, surgeries, Botox. There are treatments that gynecologists can do to help. And then lastly, with the pelvic floor physical therapy. So we're going to work as a team. We're going to work with the gynecologist, the physical therapist, and the psychotherapist. The physical therapist is going to use a hands-on technique to work out and strengthen and relax the pelvic floor muscles. They're going to assign homework weekly as well. So that was a little bit a quick summary of our treatment plan.